to breastfeed. There's an issue that some mothers are facing in terms of returning to work too soon and lack of support from workplaces. And then there is also an issue regarding misconception regarding formulas. And we also know that unfortunately some healthcare providers are still promoting formula. On the last point, I think it is important that in Kenya we do more to protect the healthcare workers from the influence of the baby food industry through stronger enforcement of the Breast Milk Substitute Act from 2012. Ladies and gentlemen, I would like to close soon, but before closing, I would like please to mention and to reiterate the strong solidarity of UNICEF with Kenya in its fight against COVID-19. And I would like also hereby to commend the government of Kenya, and especially the Ministry of Health, for the very swift and very decisive action to contain and mitigate the COVID-19 outbreak and the secondary effects on the health system. UNICEF has been tirelessly supporting the government of Kenya and the Ministry of Health in their efforts to respond to the COVID-19 outbreak through provision and procurement of medical supplies, improving access to hand-washing facilities and supplies, and also working on public health communication. In addition, we are very much engaged in supporting the ministry and the counties to maintain essential health services and nutrition services during the COVID-19 outbreak. It is critical that children, women, and communities here in Kenya are able to go and get quality health services such as antenatal care, safe delivery, immunization, natal care, safe delivery, immunization, treatment of acute malnutrition, and other common childhood illnesses. Children and families also need sustained support for preventive health practices. Kenya is progressing very well overall in child health and nutrition, and we would not wish to see that progress be unraveled due to the COVID-19 outbreak. In conclusion, UNICEF, as a member of the United Nations country team here in Kenya, will continue to support the Ministry of Health and the government of Kenya as a whole, as a government and ministry lead the efforts to contain and mitigate the COVID-19 outbreak and protect the essential health services provision to children and women in Kenya, including the protection, promotion, and support to breastfeeding. Ladies and gentlemen, thank you very much. Asanteni sana. God bless.
Thank you, Dr. Yaron, and thank you, UNICEF. Thank you, UNICEF, for your continued support to the Ministry of Health and the Government of Kenya. And I'm sure that we will continue to count on your support. Before we get off this subject, I want to bring to your attention that we have a booth at that end that has much more information on breastfeeding and the breastfeeding week that we are commemorating. Please, you are welcome to go and take a look at the information there after we have finished our session. Let me now move to the statistics, COVID-19 statistics of the day. Today, we have 538 people who have tested positive after testing 6,195 samples over the past 24 hours. This brings our caseload of COVID positive persons to 24,411. And our cumulative tests that we have conducted so far to 335,318. From these 538 cases, 516 are Kenyans and 22 are foreigners. 333 are males, 205 are females. The oldest is 85, the youngest is a 2-year-old baby. Nairobi continues to lead in the distribution of cases by counties, recording 277 cases, followed by Kiambu with 72. Others are Kajiado with 55, Nakuru 25, Nyeri 20, Muranga 15, Machakos 9, Busia 8, Mombasa and Migori 7 each, Mandera, Laikipia and Bomet 6 each, Meru, Narok, Kisii, Nzoia 3 cases each, Tharaka Nithi, Uasin Gishu and Makueni 2 cases each, Wajir, Samburu, Kwale, Kisumu, Kericho and Baringo 1 case each. Breakdown of the cases in Nairobi according to sub-counties. The 277 cases are from Westlands 32, Kasarani 23, Dagoretti North 21, Ruaraka 21, Embakasi South 19, Roysambo 18, Kibra 16, Langata 16, Embakasi East 15, Kamkunji 15, Embakasi North 14, Dagoretti South 13, Embakasi West 13, Starehe 13, Makadara 11, Madare 9, and Embakasi Central 8. The 72 cases from Kiambu are from Thika 23, Juja 8, Kiamba 8, Ruiru 8, Kabete 6, Limuru 6, Githunguri 5, Kiambu Town 4, Kikuyu 2, Gatundu South 1, and Lari 1. Kajiado's 55 cases are from Loitoktok 34, Kajiado North 20, and Kajiado East 1. The 25 cases from Nakuru are from Naivasha 17, Nakuru West 5, and Nakuru East 3. 20 cases from Nyeri are from Madira East 8, Kieni West 6, Kieni East 2, Nyeri Central 2, and Tetu 2. The rest of the breakdown is in the document that you will be given once we have completed this brief. I am delighted to inform you that at the same time, 514 patients have been released after recovery from the disease. 431 of these recoveries are from the home-based care program, and 83 have been discharged from various hospitals, bringing the total number of recoveries to 10,444. Again, I want to commend our healthcare workers for this great achievement. At the same time, we are saddened to note that we have lost 8 patients to the disease, bringing our fatality to 399. Of these 8 patients, 6 of them had underlying conditions. Only 2 did not have any underlying condition. We want to send our sincere condolences to the families and friends of all Kenyans who, during this pandemic, have lost their loved ones. I thank you.
Elfas Lagat from Citizen TV, and there's a new study from KEMRI, from samples collected countrywide, that estimates that Kenyans who may have come in contact with COVID-19 is 1.6 million. A while back, the same KEMRI had estimated that 2.7 million Kenyans had come into contact with COVID-19. What is the main reason to this discrepancy of about 1.1 million, and what does perhaps this data reveal? My other question is just seeking clarity on whether the procurement protocols were observed in awarding tenders to those who supplied PPEs to KEMSA, and whether the tendering committee of KEMSA actually complied with Executive Order number 2 of 2018 that requires them to assess the market prices, the technical and financial capacity of the winning bidder, and whether really this means, what actually does this mean in terms of whether these regulations and these terms were complied with. Thank you.
My name is Mwangi Maina from TV47. I have two questions. One, the number of foreigners who have tested positive, if we have anybody who came to the country since the country was reopened who have tested positive. And number two is that the tendering question, whether there was a pre-tendering or what criteria is the ministry following in awarding tenders through KEMSA. Thank you.
My name is Graham Kajilo from The Standard. My question is on the issues of deaths. From one of the breakdowns that the ministry has, over 50% of patients who die have underlying conditions. We have about 20 who do not have any underlying condition. Like today, we mentioned 2 who do not have any underlying condition, but we have another portion of patients whose data is not clearly known. So I would like to understand what did this patient die from? Did they die from COVID, or how comes you don't have any information on what could be their cause of death?
Okay, thank you. Alphas Lagat, you refer to the study on seroprevalence that has just come out. I happen to be an author on that publication. Earlier on, the information that we had provided when we said that there were about 2.7, by extrapolation, 2.7 million Kenyans who have been exposed to the virus, was based on a limited number of samples. Remember, this study looked at blood donors, samples from blood banks, and the number of samples that were available at the earlier time were fewer than the ones now that this study has published this work with. We went on to expand that sample because sampling is very important in research and science in order to be able to use that sample as a representative sample of the population and make those necessary extrapolations. Still recognizing that blood donors may not perfectly represent our population, I think it is still a fairly good way of looking at the level of exposure of the virus in our community. So that is why it has come down now, because more samples have been looked at in the various regions that we're looking at. And if we look at this Nairobi metropolitan area, which is really the hardest hit, I think the study revealed that at least up to 5.2% of the population is exposed has been exposed to the disease based on the fact that antibodies to the virus were detected in their blood. So as you increase your sample number, basically you will get more and more closer to the true level of prevalence, and that is why you see that refinement in terms of the numbers. There are two questions that touch on issues to do with procurement of health products and commodities by KEMSA. As you know, KEMSA is it's a SAGA, semi-autonomous government body that has it carries out its mandate of procurement following the laid down laws that govern procurement. And remember that even though we have the Procurement Act, that there are also provisions under circumstances such as the ones that we are going through now, which is a pandemic and an emergency, that there are certain flexibilities that particular law also allows. I would not want to get into what was done right and what was probably not done right, but I'm sure that we have the relevant oversight authorities that will be looking into that process, whether the process was conducted according to the law, even given the provisions that it is an emergency time. But I think that we shall leave to those agencies to determine. Mwangi Minor, TV47, I think your question was also related to the tendering, which I have responded to. Kajilwa, yours was largely on the debts and ascribing underlying conditions to these deaths. More than 50% indeed do have underlying conditions that are known, whether it is diabetes, hypertension, cancer, or some form of other non-communicable disease, or maybe even a communicable disease. That is what is meant by those underlying conditions. This percentage that you say is missing, the reason that we do not have sufficient information of that is because there is also missing information regarding the condition of these particular patients. It is not very clear from the information that is collected in the various facilities where these patients are taken care of, that sometimes we do not have the complete information arriving here in good time so that we can make that assessment. So often we may have to go back if the information is not complete that is coming back here to the ministry to determine really what was the condition of some of these patients upon death. But one thing I can tell you is that when we stand up here and say we have so many deaths due to COVID-19, that is actually a confirmed death based on a test to determine that the virus was detected in those individuals, either before death or in some cases posthumously. Okay. So I think that takes care of the questions that were posed. I want to thank you very much. Oh, yes, yes. I can say that I don't think in this number of, we said 22 foreigners today, isn't it? I don't think any of them, and I had explained this earlier, the foreigners, when we talk about them in the context of the tests we carried out, these are residents within the country. Dr. Yaron here, I think he's a Kenyan, but he could be a foreigner who's residing with us and works with us here. And you know, if he went to a facility and was determined positive, the fact that he may not hold a Kenyan passport qualifies him as a foreigner, but he's still a resident of the country. So most of those that we report here are residents in the country. We are unlikely to pick any positive coming in with the opening up of the airspaces because of the stringent protocols that have been put in place for arriving passengers, one of which is the COVID-19 free certificate and the process of screening that takes place. So this time around, as we have opened the airspace, we're definitely much more prepared in screening and determining who is able to enter this country, which is the reason why you see the list of countries from which passengers can arrive at JKIA keeps changing based on the risk level of those countries. So I don't think that we have seen any yet following the opening up of the international airspace. Thank you. So you're welcome. You can take some shots there of that booth. We have a team here.